Do you know scoliosis? Scoliosis, a condition characterized by an abnormal lateral curvature of the spine, has puzzled medical professionals and affected adolescents worldwide. Traditionally, it's been associated with physical causes such as carrying heavy backpacks or maintaining poor posture. However, recent advances in medical research have begun to challenge these long-held beliefs, pointing instead to more complex origins. This shift in understanding represents a significant paradigm shift in how we view and treat scoliosis. For years, parents and educators enforced strict rules about backpack weight and posture, believing these factors could prevent or exacerbate scoliosis. Despite these efforts, the incidence of adolescent idiopathic scoliosis, or AIS, remained consistent, leading researchers to question the validity of these preventive measures. This essay delves into the myths surrounding scoliosis, sheds light on the groundbreaking research linking the condition to brain structures, and discusses the implications of these findings. As we explore the outdated myths and unveil the scientific truths, it's crucial to approach the topic with an open mind. Understanding scoliosis through the lens of modern research not only enhances our knowledge but also directs us towards more effective interventions. This essay aims to provide clarity and hope by debunking myths and highlighting new research pathways that could revolutionize treatment options for scoliosis. Backpacks, posture, and scoliosis. The belief that heavy backpacks cause scoliosis has been a prevalent concern among parents and educators. Schools even implemented weight limits on students' backpacks as a preventive measure against the spinal condition. However, extensive studies have shown no direct correlation between backpack weight and the development of scoliosis. This revelation urges us to reconsider our approach and focus on more scientifically validated factors. Similarly, the notion that poor posture can lead to scoliosis has been pervasive. While maintaining good posture is beneficial for overall spinal health, there is no concrete evidence to support the idea that poor posture can cause scoliosis. This myth stems from a misunderstanding of scoliosis as a mere alignment issue, rather than a complex developmental condition that involves multiple factors including genetic predisposition. These misconceptions have not only diverted attention from the true causes of scoliosis, but also led to unnecessary anxiety among teenagers and their families. Addressing these myths head-on allows us to clear the air and focus resources on more promising areas of research and treatment. By understanding what does not cause scoliosis, we can better understand what does, leading to more effective prevention and management strategies. Section 3. Breakthrough Findings: The Brain-Scoliosis Connection. In a pivotal 2024 study conducted by Singapore General Hospital and the National Neuroscience Institute, researchers unveiled a significant link between brain asymmetry and the development of adolescent idiopathic scoliosis. This study marks a departure from conventional theories that focus solely on physical stressors, shining a light on neurological factors that could predispose individuals to scoliosis. The findings suggest that variations in the brain structure might influence how the spine curves, offering a new avenue for understanding the condition. The research specifically pointed to differences in areas of the brain responsible for posture and spatial orientation. These discrepancies could lead to abnormal spinal curvatures, as the body attempts to compensate for misaligned signals sent by the brain. This breakthrough provides a compelling explanation for why scoliosis develops in some adolescents despite the absence of external physical factors. This new perspective not only deepens our understanding of scoliosis but also opens up potential new modalities for treatment that target the neurological aspects rather than merely addressing the spinal curvature mechanically. The shift from a purely physical to a neurophysical approach in studying scoliosis represents a revolutionary shift in the field, promising more targeted and effective interventions in the future. Section 4. Implications for Treatment and Prevention. Understanding scoliosis as a condition influenced by brain structures rather than just physical factors alters the landscape of both treatment and prevention. This insight could lead to the development of novel therapies that address the neurological roots of the condition, potentially improving outcomes for patients. For example, treatments could involve neurostimulation techniques or targeted therapies that correct the asymmetrical brain functions found in scoliosis patients. Moreover, this shift in focus could also influence preventive measures. Instead of concentrating solely on external factors like backpacks or posture, future preventive strategies might include early screening for brain asymmetries in children. This proactive approach could identify at-risk individuals early on, allowing for interventions that could potentially slow or even prevent the progression of scoliosis. The implications of these findings are profound, not only for the medical community, but for millions of adolescents and their families. By aligning treatment and prevention strategies with the latest research, we can foster a more informed and effective approach to managing scoliosis. This could significantly enhance the quality of life for those affected by the condition, reducing both the physical and psychological burdens associated with it. Conclusion: a new paradigm in scoliosis management. The journey from believing scoliosis is caused by physical strain to understanding its complex connections with brain structures represents a monumental shift in our approach to this spinal condition. This evolution in thought underscores the importance of staying abreast of scientific research and remaining open to new insights. For parents, educators, and healthcare providers, this means adopting a more nuanced view of scoliosis, one that appreciates the intricate interplay between the brain and the spine. As we move forward, it's crucial that these findings are not just noted but actively integrated into treatment and preventive strategies. This will ensure that adolescents receive the most current and effective care, potentially easing the burden of scoliosis for future generations. By debunking old myths and embracing new research, we pave the way for a brighter, healthier future for those affected by scoliosis. In conclusion, the shift from viewing scoliosis as a purely physical condition to understanding its neurological connections is not just a scientific advancement but a beacon of hope. It promises a new era in scoliosis management where treatment is as much about the brain as it is about the spine. This holistic approach could redefine what it means to live with, manage, and understand scoliosis, turning old fears into new possibilities.